Welcome to the Center for Opioid Research, Education, and Outreach webinar series. This program is made possible by a grant from the Alabama Department of Public Health in cooperation with the Centers for Disease Control and Prevention.
Hi, thank you for joining me today. I'm going to be talking about having difficult conversations. My name is Cherry Jackson, and I'm a professor of pharmacy at Auburn University's Harrison School of Pharmacy, and I'm a clinical professor at University of Alabama's Department of Psychiatry. Today, our program is being sponsored by the Alabama Department of Public Health and also the Center for Opioid Research, Education, and Outreach. I don't have any financial disclosure or conflict of interest associated with this material. And we're going to be discussing the following objectives. We're going to talk about some of the steps for an effective communication, and I basically have 5 steps I want to go over with you. And then we're going to be talking about some tips for successful conversations. For example, how to approach the topic and showing empathy. And then I'm going to give you some pertinent resources. So when somebody's drinking too much or using drugs like opioids or struggling with their mental health, a lot of times support from family or friends or a healthcare practitioner can really help them to get the treatment that they need. And so these conversations can often be very difficult. It's hard to get them started. But starting the conversation can be a great first step to getting help for the individual. Now, the very first step for having a difficult conversation is to be prepared. You need to really sit down and think about what your concerns are, and you want to start with your outcome in mind. What do you want to happen for this particular individual? And you want to determine how you can speak most persuasively to the individual that you're going to be working with. A couple things you need to ask yourself before you get started is, can I sit down and listen? And I'll probably say this again, but really you should spend 70% of your time listening to the individual and only 30% of your time talking. You want to think about, can I show empathy when I'm talking to the patient? And empathy is not the same as sympathy. It doesn't mean you agree with the person. It means that you can listen to the person and you can respond to them. So you want to be able to put yourself in their shoes. And then you want to be able to manage your emotions around the issue. Usually when you're talking to somebody about their substance use or mental health, there's a lot of emotion involved both on your part and on the individual's part. And so you want to make sure that you can contain those emotions when you're having that discussion. There's some nonverbal skills that we want to pay attention to. One is we really need to pay attention and think about what the person is saying to you. We want to be able to use comfortable eye contact. You want to have an open body position, and what that means is keeping your arms at your sides. You don't want to have your arms crossed in front of you. So just kind of looking at the person and keeping your arms by your side, your feet in an open stance rather than being crossed all that can be helpful. You want to sit down even if the other individual is standing, because sometimes when one of the individuals is standing, then it's considered to be a situation where one person has more authority than the other. So you want to sit down even if the other person is standing. And you don't want to fidget when you are talking to the other individual. So step 1 of having a difficult conversation is identifying a place, a time, and a location. And you want to make sure that that location feels safe for the individual you're speaking to. So you don't want to talk to somebody when they're with other people. You want to find somewhere that's going to feel comfortable. That may be in a separate room. That may be taking a walk. But make sure that feels safe for the individual you're speaking with. You want to invite the person to talk. You don't want to force them to talk. If you're not a friend or a family member, you want to make sure to introduce yourself properly and then you want to thank the person for agreeing to speak with you. And you, again, I'm going to say this over and over, but you're going to want to use really good listening skills. You want to kind of build an empathetic relationship with the individual. You want to build support and understanding with them in order to have a successful conversation. You want to be able to deal with the emotional content of the conversation. You don't want to get very emotional, and you need to be able to be calm and reflective and to help that person because they may become very emotional. You don't want to be confrontational, and you don't want to be judgmental. We're going to talk a little bit about tips for non-judgmental listening. And you want to pay attention to your attitude and how you convey it. So oftentimes we may not agree with what the individual we're speaking with is doing. We may not agree with their perspective, but we need to watch and make sure that we are respectful of them. The key attitudes that you want to use are acceptance, genuineness, and empathy. And I'm going to talk a little bit more about these three things. Again, you want to at first respect the individual's feelings, their personal values, and their experiences. You want to recognize those as being valid, even if they're different from your own and even if you disagree with them. You don't want to judge, you don't want to criticize or trivialize what the individual says. Because again, you may have different beliefs and attitudes than the individual you're talking to. And that may mean for you withholding any judgment that you have made about the individual or the circumstances that they're under. Genuineness means that what you say and what you do are the same, and that you accept that person. So you don't want to hold on to one attitude while expressing another. And a lot of times your body language and your verbal cues will reinforce if you accept the person or not. And if you tell the individual that you accept them and that you respect them, but you have a defensive posture, for example, crossing your arms in front of you or avoiding eye contact, the person's going to know that you're not being genuine with them. We talked a little bit about empathy already, but just again, your empathy is not sympathy. So you're not feeling sorry for the person. What you want to do is listen enough that you can imagine yourself in the other person's shoes. Again, you want to talk less, listen more. You really should be listening about at least 70% of the time. If possible, you want to let the other person go first. You want to let them speak and listen to them and find their perspective on the conversation that you're having. You want to recognize and acknowledge their fears for the situation. A lot of times when, for example, people are misusing a drug or alcohol, they may not even realize that they're misusing the drug. And so this may be new for them. You want to, if you talk to them about coming off of a drug or stopping alcohol, it's important to recognize that they may be scared about doing that. What's that going to mean for them? They may also, probably know going through withdrawal from a substance is very difficult and very miserable, and it takes a long time to come off, and they may be very scared about that. And so you need to acknowledge their fears. You don't want to be glib with the person, and you just really want to show them that, that you care for them.